at the end of the day, you're collecting this data for a reason to inform what you're doing. So why would you try to cheat to manipulate the data? It's just going to misinform you.
G'day and welcome to Fuel In Sessions, the podcast that delves into the science of nutrition. Fuel In Sessions is powered by Fuel In, the AI nutrition app that makes nutrition simple, personalized, and adaptive for all athletes. We're here to share expert insights, training tips, strategies, and of course, some laughs so you can fuel your best and reach your peak health and performance. My name's Scott Tyndall. I'm your host and Chief Nutrition Officer for Fuel In. Once again, 2 Scoops of Science with Dr. Alan McCubbin. Al, welcome back. I'm looking forward to this one.
Yeah, I think it's a really interesting one. Thanks for having me.
No, pleasure. Mate, this one is about resting metabolic rate, assessment of that, and also DEXA, dual X-ray absorbometry, or what we typically will use to assess body composition, but also can be used to assess bone mineral density. I thought before we get into this study, and the title of the study, which I think is a good one, is The Impact of Acute Dietary and Exercise Manipulation on Next Day RMR Measurements and DEXA Body Composition Estimates. Some heavy hitters in the author list, Louise Burke, Kirsty Elliott-Sale, Catherine Ackerman, amongst a few. Do you want to just give a little bit of background? And Trent Stellingworth, sorry, nearly forgot him. Do you want to give a little bit of background about where the authors are located and their relationship to this study?
Yeah, so the authors, or the primary author, is Megan Kookman, and I'm not sure if she's just finished or just about to finish her PhD at Australian Catholic University, which is where Louise Burke is situated. So they have a couple of campuses around Australia, but I think they're mostly based here in Melbourne, where I am. So the main research team involved in this study are based here in Melbourne, and then they have collaborations, as you said, with quite a few fairly well-known researchers worldwide. So Kirsty Elliott-Sale is based in the UK, in Manchester, Kate Ackerman in Boston, Trent Stellingworth is over in Victoria, Canada. So yeah, some big hitters, and I guess they all have particular expertise and interest in research around areas of low energy availability, around female athlete health in particular, and that's all relevant to this particular study. There's a component to this study that was looking at various different hormones. We're not going to talk about that today because it was more around, I guess, trying to get some standardization for research, which is not relevant so much to listeners. So we'll skip over that part of the study, but it was included in there as well.
Yeah, thanks for that. I think as I mentioned, the study is looking at metabolic rate or resting metabolic rate and DEXA. And I think even before we get into the results of the study, well, maybe we do just front it up really quick and just say, okay, what did it give us? It gave us some insights. It gave us into that we don't have to be too obsessive about training and diet when it comes to RMR measurements, which I thought was really interesting because quite often, and probably including myself, I'll often say, oh, perhaps, you want to go easy the day before in terms of exercising because it could have an impact on RMR. I guess the caveat to that is that RMR and DEXA are often done on the same day, often back to back. And what we did see with the results, which we'll dive into in more detail, is that you do need to control the day before nutrition and certainly exercise when it comes to DEXA, because that could have implications on some of the results that you will be given by the assessors.
Yeah, absolutely. So there's a couple of parts to this. The DEXA side of things is not necessarily new. So Louise Burke and her team, she used to be at the Australian Institute of Sport, and they did a huge amount of work probably about 10 years ago. There was at least 2, possibly 3 PhDs dedicated just to this topic of what do you need to standardize to get the most out of your DEXA scans and to make them most consistent to be able to interpret them from one scan to the next. Now, they obviously are looking at the very elite level of athletes, and often also things like para athletes where they're looking at prosthesis and stuff, and so they need very controlled and very good detail of like even left to right limb discrepancies and things like this that maybe the average person doesn't need from their DEXA scan. But they spent a huge amount of time looking at that standardization, and then they've added to that here. But the RMR side of things is new, and it's an area that certainly I know you just mentioned that you've often pondered, and I've often had in the back of my mind is what is the effect of a hard day's training on RMR the next day? Is it going to mess up our measurements? And the one caveat I would say here, and we'll go into it shortly, is that the exercise here was definitely not hugely strenuous. It was 2 to 3 hours worth, but it was all sort of zone 2 to maybe low zone 3 type exercise. It certainly wasn't going out and doing a big interval session or the day after a race or anything like that.
Which will clearly, we don't know if it has implications. I guess that was one of the questions, like all good research, more information or more research required. DEXA scan and metabolic cart or resting metabolic rate. We hear these terms. A lot of people throw it around there. I'm certainly guilty of just saying to athletes, get a DEXA or get an RMR or you go and get a metabolic assessment. Do you want to just dive into those two terms? What is a DEXA scan?
Yeah, so DEXA, as you said before, is dual energy X-ray absorptiometry is the official term. Anyone who's had a DEXA scan will know that it's a little bit like lying on a bed with a thing that sort of passes over the top of you, and then you get a fancy-looking image that looks a bit like a whole-body X-ray at the end of it. And obviously the X in there is X-ray, and you would have picked that up before. But essentially, it's a two-dimensional image, and that is an important point when we're thinking about body composition. It is from a two-dimensional image. And it was originally developed for measuring bone density. It's the same machine or same tool that's used for diagnosing osteoporosis, for example. Although in that case, they only measure just a specific part of the body, usually just the spine or the hip joint to make those measurements. Whereas for body composition, obviously, it's a whole body scan. Now, the availability of DEXA varies depending on where you live, and the cost varies quite a bit depending on where you live too. So here in the state of Victoria, here in Australia, for example, there's a lot of restrictions around who can and can't get a DEXA now. You pretty much have to have a clinical, medical condition to get a DEXA. And the reason for that is that, like a normal X-ray, a DEXA does involve a dose, it involves radiation. It's a medical imaging technique that involves radiation. It's a very small dose, much smaller than a standard X-ray. But it is a dose nonetheless. And so there is regulation around that, which varies from place to place depending on where you live.
I have read that the dose is the equivalent of something like 700 plane flights in terms of radiation. I don't know if that's a fact or fiction, but the dose is so low that a lot of people are like, well, hold on, it's so low. Why is there this restriction when clearly there's no restrictions on, going through airport screening and flying?
Yeah, I think it's certainly more than that. But it is relatively small. And certainly here in Victoria, for example, yes, you need to have, I guess, a legitimate clinical reason to use it. But even then, there's regulations put in place to prevent people having more than 4 scans a year as well, in terms of that radiation dose. But yeah, you're right. Going up in a plane, you do get a bigger radiation dose than what you get here on the ground.
Yeah, it's funny because, I guess this whole world of trying to be preventive in terms of can we get ahead? And again, we're talking about Australia here, but, an assessment of bone mineral density, I think, is at 70 years of age is when they'll typically do a bone mineral density scan, which I always think, by 70, it might be a bit too late. I think we've mentioned this many times before. Unfortunately, we have seen, I would consider, a very large percentage of young individuals who are involved in endurance sports, unfortunately, with lower bone mineral density than what we would expect. So, I'd probably sit more on the let's investigate and let's have a look. Let's not wait for a disease process to occur. But, it is, as you say, it's the state of Victoria that has that legislation. Luckily, in New South Wales, we don't have those restrictions. In America, it doesn't seem to be those restrictions. And there's certainly many companies that are doing DEXAs, which, when used in the right context, I think they can be very beneficial. So the DEXA will give us, what will give us? It will give us bone mineral density, and it will give you body composition assessment of lean body mass, fat mass, what else?
And bone mineral content.
And bone mineral content.
So it'll basically break body composition into 3 parts. So it'll give you bone mineral content, so the mineral component of your bones. Obviously, that's not all of your bones, but it's part of it. And it's the part that's used for bone mineral density as well. It'll give you an estimate of fat mass and then an estimate of what it calls fat-free mass, which is basically everything else. And I think that's an important point because people often, I think, confuse fat-free mass and muscle mass. They're not the same thing. So fat-free mass includes all of your organs. It does include muscle and includes all the water in your body as well. It includes any food that's sitting around in your gut that hasn't been digested and absorbed, or fiber there that hasn't gone out the other end in the toilet. All of that counts as part of that fat-free mass as well. And that's where some of these exercise and diet manipulations are important, and why this research group and when they were at the Australian Institute of Sport prior to that have spent so much time looking at this, because obviously with athletes, you've got much more extremes in terms of the amount of carbohydrate, the glycogen that's stored in our muscles, and that's part of that fat-free mass. It's going to go up when we eat lots of carbs before exercise, but it's also going to drop significantly when you do a big exercise session as well. So you're going to see bigger fluctuations probably than the average non-athlete over the day for those sorts of things. They've even looked at things like creatine, where the creatine supplementation is going to impact the result you see on a DEXA scan the next day. So yeah, there's a lot of factors here to consider with the fat-free mass component, although the fat mass component, and they saw that again in this study, was fairly stable no matter what you did.
Yeah, it's all very interesting when you look at those specific elements, and I think it's really good that you did outline that difference in lean body mass versus fat-free mass, because I think it is such a confusing, that interchange of those terms as well, and even within studies, the use of the terms is sometimes confusing or confused by the authors. The only thing I would add to that is when you are getting assessed, apart from what we're going to talk about, dietary and exercise manipulation and impact on that, but also what I have seen is individuals who lie down and then they'll have their arms slightly cut off or their feet cut off from the image, and that will have a huge impact on the results. So I would caution anyone who is getting a DEXA, make sure that they use like paddles where it keeps your arms firmly against your side, that they tape your feet together, and that it's standardized in that way. It was interesting talking. I remember when I worked over in America, talking to some of the MBA practitioners, and they said that they would have to they often couldn't use it because, the MBA players were so tall, they'd either get special made beds and units for these basketball players, or actually have to assume that, yes, the head was cut off, and they'd take that into account. So
makes a good image.
Yeah, population specific. Okay, so that's DEXAs, and then metabolic cart, resting metabolic rate. Do you want to give a quick insight into what that means so listeners understand what that is when they're asked to go and get it done?
Yeah, so resting metabolic rate is essentially an estimate or a measurement of the amount of energy your body's using at rest when it's literally doing nothing other than being awake. And that is important because it does change when you're asleep compared to when you're awake. So it is important. We do have this occasionally with people. We've got to keep them awake during the test. You're not meant to fall asleep during an RMR test, even if it is relaxing and you're away from the kids and the computer and all those kind of things for a change. But yeah, resting metabolic rate essentially is looking at what your body requires or what it's producing energy-wise just to maintain its normal body functions when it's not doing anything. So it's not moving, so it doesn't require extra energy for movement. It doesn't require extra energy for digesting and metabolizing food, all of those things. But it's just the baseline functions, all your vital organs doing their normal thing and all your cells idling away, keeping you alive. And that measurement is done using, as you said, what's called indirect calorimetry, which is the same system that's used for doing a VO2 max test or measuring fat or carbohydrate use during exercise, which we've talked about in previous episodes. Sometimes they use different attachments. just to make it more comfortable and better, more reliable measurement of people at rest compared to during exercise. But it's the same concept. It's basically measuring how much oxygen you're taking up into your body, how much carbon dioxide's coming back out, and using those principles to basically work out how much energy you're producing and how much of that is coming from fat versus carbohydrate as an estimate as well.
Yeah, and I think what we've also seen, and just again a word of caution with obviously we'll talk about the exercise and nutrition component, but I think the measurement procedure is really important for athletes or anyone going and getting assessed to just take note of and be aware of this. So generally recommend that you arrive at least 15 or 20 minutes early to your assessment and that you are seated and rested for that 15 to 20 minutes before you actually go and get assessed. In terms of assessment, you should be lying supine or on a slight incline, usually around 20, I think it's around 20%, isn't it, incline, that you're generally lying supine on that incline bed.
Yeah.
Yeah. And then, as you said, I mean, the preference for me would be a full face mask as opposed to a mouth tube, just to ensure that you are actually collecting everything that is meant to be collected and not losing and not getting sort of an abnormal reading. So often they'll use like a nose peg with a tube in the mouth, but I think a full face mask would be definitely my preference there. And then the actual assessment time. I've spoken to many athletes and they're like, oh yeah, the test was over in sort of 5 or 10 minutes. And it's like, well, that I don't know if they will have actually got an accurate reading, especially around the respiratory quotient over that duration of time. So I think what I would also encourage athletes to do is the assessment should take at least 15 minutes, if not longer than that. And that RMR will probably take you at least 20 minutes. So all in all, allow an hour for that RMR. And if the person who's assessing that is trying to push you through because they've got back to back every 30 minutes, you might be better off served going somewhere else.
Yeah, absolutely. Because as soon as you're rushed, as soon as you're stressed, as soon as you're moving, all of those things are going to increase those calories that you're burning. Not a huge amount, but slightly, and it's going to affect the measurement. So you want to be as relaxed and as still as you possibly can for that measurement. And it's usually recommended that you rest lying down or in the position where the measurement's taken for a minimum of 10 minutes, preferably a bit longer before you even, you've got the machine on, but you don't actually start collecting data from it until you've been completely relaxed there for at least sort of 10 to 15 minutes, preferably more 15, 20, to make sure it's a true resting metabolic rate. And I think that, the word resting there is the important part. The other thing I was going to mention there, you said obviously, the mask is preferable to the nose peg and the mouthpiece, and I totally agree with that. The other one that is commonly used, depending on where you go, is what's called a ventilated hood. So it looks like kind of a bubble that you're encased in, that it sort of seals around sort of your chest and shoulders, but that sort of allows you to breathe a bit more naturally and feel, obviously there's a bit of claustrophobia there, but maybe a little bit less than having a mask right over your face there, and allows you to breathe more naturally, which again is going to get you into more that relaxed, truly rested state. So the RMR that you're testing is reflective of your actual RMR.
I've never actually used one of those hoods. Have you been under one of the hoods?
Yeah, not for a long period of time. Probably only we were just doing some testing and calibration, so it was probably only for 10 or 15 minutes. Yeah.
It is you mentioned claustrophobia, and I think it is something just, again, for athletes to be aware of, or individuals getting any of these assessments, even with the face mask on. It can feel a little claustrophobic, so just be prepared for that when you are doing it. Okay, so let's get into the study. We understand what a DEXA is. We understand what a resting metabolic rate is. We understand the high-level implications of the study that we're going to talk about. But let's talk about what was studied and then the individuals that were studied in this particular research paper.
Yeah. So what was studied, and they did a great job, I think, describing this in the title of the paper, but they were really trying to look at whether changes in what you're eating and also exercise the day before both of these tests affects the result of the tests. In other words, if you're going to do an RMR and a DEXA and you want to do it properly and you want accurate data, do you need to either completely refrain from exercise the day before? Do you need to standardize what you're eating? And it's not just for a one-off test. Usually if you're going to do something like a DEXA, it's more valuable to you if you're measuring it multiple times over a season or over multiple seasons to see how things have changed, because a one-off value doesn't necessarily mean that much. It's what's changing from one time point to the next. And so if you've got variation in the data because of, one day you came off a big training block and then went in and did the test, and the next day you were in the middle of your off season where you hadn't exercised for 4 days, would that affect the result? Obviously, that's important to know. So as we mentioned, it's something that both you and I have pondered quite a lot, particularly around the RMR side of things. Is it going to mess up the measurement? So that's pretty much what they studied. They manipulated both of those factors and then did both of those tests the next morning to see what would happen.
Yeah, perfect. And who was involved in the study in terms of the participants? What did we have? How many males, how many females, and what sports did they do?
Yeah, so 10 males, 10 females. They were runners, cyclists, and triathletes. So perfect for this podcast. And they were all what they call tier 2, tier 3. So basically recreational and sort of competitive age group style of athletes. So again, probably fits with the majority of fueling users. They certainly weren't elite or professional athletes, and they weren't couch potatoes either. They were people who would be doing what most of our fueling users are doing, running marathons, doing triathlons, racing crits or their club road racing, all that kind of stuff. So the males on average were about 38 years old and the females 33. Again, that probably fits right in that kind of typical demographic of age groupers. The males had an average VO2 max of 51 mils per kilo per minute, and the females 44, which probably, I wouldn't say the non-competitive end, but certainly it's not at the sort of the upper end of what you would expect for people winning their age group. It's probably sort of mid-pack if you want to describe those people in a nutshell.
Yeah, I think it's a fairly average person in that sense. And I don't mean average in terms of, them being average in terms of skill, but probably, as you say, middle of the pack. And that range, yes, the average was 38 and 33 for male, female respectively, but they had about 9 years sort of flux each way, didn't they? 7 to 9 years. And so, we had a really good split. It was probably up, between 30 and nearly up to 50 years of age as a demographic. So I think, again, it fits really well with our demographic of fuel end users. And so I think this study is actually quite applicable to them when we look at that. So what did they do?
Yeah, so basically as I said, they manipulated diet and exercise the day before doing these tests, and they actually did it 5 times, so under 5 different combinations of conditions that they studied, which is a big effort for people to come in and do that kind of testing 5 times. So kudos to the participants in this study, and that's probably why they only had 20 in it, because it's hard to get people to have that time commitment to do it. So basically, if I run through the 5 combinations of things that they did, the first one was what they would call, so I guess just a caveat firstly, they were doing it in terms of energy availability, and we've talked about low energy availability here before. I guess we can think about it more so in terms of calorie excess, calorie balance, so trying to maintain weight, and then a calorie deficit for weight loss is pretty much how you could sum these up. So the excess energy availability, as they described it, is essentially giving someone enough calories to put them into weight gain. Obviously, on one day, they weren't going to gain weight, but had they gone on with that amount of calories for weeks at a time, you would expect that they would gain weight. So they did that one with no exercise, so complete rest and a calorie surplus. They then did what they called high energy availability, which is basically just enough calories for weight maintenance, with or without exercise. So 2 different conditions. So weight maintenance with exercise, weight maintenance without exercise, and then what they called low energy availability. So basically being in a calorie deficit with or without exercise. So they were the 5 conditions that they studied the day before. And so they provided all the food so they could manipulate the amount of calories they were getting, and then they obviously controlled the exercise very specifically to set up this energy availability as well, and to give a standardized dose of exercise across all the participants.
Yeah, I mean, they went pretty hard, I guess, in the low energy availability as well. When we typically have referred to low energy availability, we've talked around that 30 calories per kilogram of fat-free mass. They actually went to 15. So they went, and I assume they did that because men maybe are a little bit more resistant to that low energy availability. And, that number of 30 potentially applies more to females, pardon me. But we know men maybe are a little bit more resistant. So they really pushed it down into that 15 calories per kilogram of fat-free mass, which I thought was quite clever, actually, because it did account for the sex difference potentially.
Yeah, and also you want to see the effect. So, had you gone to 30 and seen no effect, you'd be left going, oh, okay, well, maybe the energy availability just wasn't low enough to see something. Maybe we should have gone to 15. So, with a lot of these research studies, when something hasn't been done before, you go to the extreme ends first. And then if there's an effect, then you can work your way back to find where that effect starts to kick in. Whereas if you don't go extreme at the start, you don't see an effect, well, then you're like, well, is there no effect? Or do we just need to push it out and do it again and again and again until we find it?
It's a bit like the carbohydrate study that we discussed with the glucose only, and they pushed it up to 90 grams per hour of glucose only. And it was like, oh, why did they do that? We know that that's above. And it's like, that's the point. It's above the threshold.
Yeah.
Okay. So they did those exercise groups, five consecutive days. Is that how they did it?
Oh, no, there's 5 different trials.
Different trials.
Yeah, so what they did was they had a single day of exercise and diet standardization, so it was the same in each 5 of the 5 trials, just in case, the day before was affecting things as well. And then the day before the testing, they had those 5 different scenarios. So from an exercise point of view, when they were doing the exercise, they were doing 2 cycling sessions, one in the morning, one in the afternoon. The morning session was done at 55% of VO2 max, so that would be sort of mid-zone 2, I suppose, for most people. The males, it was about 157 watts. The females was 103 watts. And that ride was for about 2 to 2.5 hours. Obviously, it was calculated to set up the energy availability. So it was different in different people, but standard within those people because they're essentially their own controls doing all the different trials. The afternoon session was standardized in terms of the duration, so it was 60 minutes for everyone, and it was at about 65% of VO2 max, so that's probably upper end zone 2 into the lower part of zone 3. And that was scheduled, that session, to finish exactly 12 hours before they were going to do the RMR measurement the next morning.
And I think that's important because then they did a 10-hour fast, didn't they, from the night before and 12 hours post-exercise. And then they assessed resting metabolic rate, did a full body DEXA scan. And as you mentioned, they did do bloods to assess markers of low energy availability, but we're not going to touch on that today. Okay, what do we see in a nutshell?
Yeah, so I think that the first thing with the RMR, and this was quite interesting because I had expected maybe to see some differences here, but they actually didn't see any differences in RMR with these manipulations. Now, as we said before, this wasn't particularly strenuous exercise. Yes, it was sort of 3-ish hours of exercise, but it was all kind of zone 2, 3-ish. But that suggests if you're doing sort of long, slow distance training, as long as it's not, 5, 6, 7 hours, this is probably applicable to you, and you don't need to worry too much about avoiding that or trying to schedule an RMR test if you're doing one to avoid doing it the day after a long sort of zone 2 or even a little bit into zone 3 type training session. So the exercise didn't affect it, and the diet manipulations didn't affect it either.
I thought where I thought that was really applicable was thinking about scheduling in maybe an RMR. And so it could be typically an athlete on a Monday will have probably recovery session, and their coach will typically put in, an easy bike or an easy run, something like that, maybe a swim. Therefore, if you were scheduling something like, getting the RMR done, potentially Tuesday could be a great day to schedule it in.
Before training.
And you don't have to therefore affect or impact your training schedule. And I think that's a really good practical takeaway from this when talking to your coach. Hey, let's do a normal Monday. Let's book this in for Tuesday.
Yeah. Yeah, absolutely. And depending on what sort of phase of training you're in, possibly what you're doing on the weekend is all sort of zone 2, 3 and not more than 2 or 3 hours anyway. And so it probably doesn't matter too much. You could do it on the Monday. But I guess if you're in a heavy training block, you're doing big volumes of training, or you're doing lots of interval or higher intensity sessions, then maybe that Tuesday approach, or the day after an easy or rest day is the way to go.
Yeah, I guess the only thing again you look at those watts, they were pretty low.
Yeah.
And again, I'm thinking of the average fuel in athlete might be going, well, hold on, my watts are a little bit higher than that. The females are only pushing just over 100 watts. The men only just over 150, 160 watts. They might be like, ooh, what is the impact of that? And maybe that absolute intensity, if it did, I mean, if it was still the same relative intensity, maybe it doesn't matter. But I guess at this point in time, we don't.
Yeah, correct. Yeah, and the second session was higher. So that was the first session. The second one was a bit higher. I haven't got the watts in front of me, but that was 10% of VO2 max higher. So you would expect the wattage to be, I don't know, 30, 40 watts higher, I'd imagine.
Okay, so that was RMR and body comp. What did we see?
Yeah, so with the DEXA,
Al, there was a suppressed RMR though. Can you just go through that?
Oh, yeah. So they did find some what they called suppressed RMR. And this is one of the things, or one of the reasons that people use RMR, is to try and find an indication of low energy availability playing out in an athlete. So if you have an RMR and it's more than about 10% below what you would expect it to be when using a predictive equation, that's often been suggestive of, okay, maybe they're in low energy availability. So what they found is, of the 20 athletes that were tested, 16 of them had suppressed RMR by that definition at least once throughout the 5 tests that they did.
And what are the implications of that? What do you read?
Well, the authors spent a bit of time sort of conjecturing about this, and I think the answer is we don't really know for sure. I think, this concept that low RMR is a sign of low energy availability has kind of circulated around and pretty well recognized, I think, by a lot of athletes and coaches nowadays. But it's certainly, I think, got probably ahead of the science in a lot of ways. It's kind of just assumed that that's the case, and whereas the science is kind of saying, well, it might be the case, but we're not 100% sure. And whereas people are kind of just taking it as a fact these days. So it is one of the things that they talked about in this study. And it's one of the things I know we've talked about a lot amongst us as fueling coaches, because one of the typical times you see an athlete come in to get an RMR is after they've had a stress fracture. So something's gone wrong that is often linked to low energy availability. So they come in and have the RMR. They book it in. There's a 2-week wait or a 3-week wait or whatever. So they come in. By the time they come in and do the test, it's been 2, 3, 4 weeks after the stress fracture. The RMR is completely normal. And, is that because it was normal, or was it suppressed the day before the stress fracture, but because they've been forced to stop training for 3 weeks, it's now returned to normal by the time you've tested it? So it is certainly tricky. I think the other thing here is that, we're talking about variances of, more than 10% from predictive equation. It's not a lot. If someone's got an RMR of 1800, we're only talking about 180 calories in either direction. Whereas I think, again, in the public, there's kind of this misconception that, oh, it's not me, it's my metabolism. My metabolism could be 500, 600 calories a day different to what an equation would predict it to be. But if you're that different to what the equation predicted it would be, there's probably some sort of major medical issue going on or a problem with the test.
100%. Couldn't have said it better, Al. Then we would, again, been sent so many emails and people come in and they'll say, no, I've got a resting metabolic rate of 2,500. And you're like, I don't think so. Not given your body weight and your age and probably what you would expect based on an equation. And yes, the equations can be out. They can be out by 10%. But as you said, that 10%, it's not a heap of calories, maybe 180, 200 calories, but it's not going to be 700, 800 calories out. So I think if you do see a number, and I always say this to athletes, it's like, go back to what we were talking about before. How was it done? How was it performed? Was the methodology, the assessment, was that performed in exactly the way that we said, rested, then it took a while, full face mask where you're on an incline, where you're supine. Did you go through that procedure when you got assessed, or was it like, oh, quick sit down, sit in a chair, put a tube in your mouth and do it assessed, and it's all very rushed and a bit hectic? Because as you said, that will definitely elevate those levels up, and also in the other direction, you might get this suppression, and it could be. I mean, it's unlikely, but you could have a reading that is significantly lower, and it could again be due to the procedure.
Yeah, and I guess on the lower side, probably, and certainly from my experience doing RMRs at the university, the most likely reason is probably an error with calibrating the machine before the test was done. And that can happen as well. You can do the perfect test in terms of lying down, using the right equipment, doing it for the right amount of time, being fully relaxed and all of that stuff. But if the person didn't calibrate it properly in the morning, or there was an error there, or there's just something going on technically with the machine, you can have a measurement that's out as well. So yeah, I think it's really good or important that if you see numbers on your test that don't look right, you need to ask those questions first before just assuming that's my metabolism. I'm some ridiculously massive outlier.
Ask the why, and don't be embarrassed about asking. And if you recognize when you're listening to this, you're like, my God, I didn't get any of that done. Like, go back to the people and say, actually, I think I need another test. And I often say to them as well, just have a bet with them. Say, look, if it's completely different, maybe you made the mistake. If it's exactly the same, okay, well, maybe you were right and I'll pay for it. The other thing I think we haven't mentioned is actually the quality of the type of machine. I think we saw this, didn't we, and I know there was some conjecture about that study where they did the comparison of sort of, I think it was 15 metabolic carts, and they sort of went back over the data. But I think there is a definite difference in measurement and measurement error between the gold standard sort of metabolic carts versus some of these portable ones.
Absolutely. And also just differences between machines that are not necessarily wrong, but it's just like the machines just work slightly differently. And it's just like when we talk about measuring body weight, you try to use the same set of scales every time you weigh yourself. If you're going to do RMR, try to use the same lab and the same equipment each time that you do the measurement. And if they've got more than one machine, try and request that you use the same machine each time, because there might be slight differences even there that result in differences from one measurement to the next. That's actually the machine, it's not you.
Yeah, I mean, Holly and I were talking about this, like, because, she was getting assessed, but then couldn't go back to the same place. And then it's like, oh, well, we have to expect that there could be, if there is a difference in the numbers that we're seeing, we're just going to have to, take it with a pinch of salt, because it is a different machine. And I think actually Ben Canute had the same issue, because he recently relocated to Boulder, and it's like, we can't use the same DEXA machine. So, okay, that's good. Outcomes for body composition. With the resting metabolic rate, we saw that there was no real impact from exercise and dietary manipulation the day before. What did we see with body composition?
Yeah, with body composition, we saw pretty much what this same research group have shown previously from other studies that they've done, and that is that there is an impact of both exercise and diet manipulation on the DEXA body comp estimates, and in particular, it's the fat-free mass component. So the fat mass component was more or less the same for each type of measurement, but the fat-free mass part is the bit that's varying depending on whether you've exercised the next day, depending on what you've eaten, how much you've eaten, and so on. And this fits with their previous work looking at, differences in glycogen, differences in hydration, and these sorts of things, and even creatine supplementation impacting on that. Interestingly, for this particular study, they didn't see, because with the DEXA scan, you can break the scan down into the different components of the body, and they actually saw most of this difference happening in the trunk, which would actually suggest it's maybe not the hydration and glycogen side of things, which might be more obvious in the arms and legs, but it was more around the torso. So they did sort of have a bit of conjecture about why that may or may not be. It could simply be, even food content in your gut can influence that result. So it's an interesting one, and they were still not really 100% sure why the differences were shown just in that part of the body and not in the arms and legs. But it does suggest that, yes, you do need to be careful if you're going to do a DEXA about trying to standardize those things from one measurement to the next as best you can.
Yeah, you mentioned glycogen there, because actually why had this experience being in that ketogenic study, where, if you have very low glycogen, suddenly you're getting told that a lot of your lean body mass is, probably diminished, and that you potentially have a little bit more fat mass on you. So I think it is important for especially around the legs and arms, as you mentioned, probably not as applicable for the trunk. But if you do see really different values and you have chronically, not just acutely manipulated your diet, it could be impacting sort of the DEXA results as well.
Yeah. And I guess one of the things there, like I mentioned that fat mass wasn't affected by the result. It was only the fat-free mass. However, I'm talking about fat mass in grams, the way it's measured on the machine. But of course, a lot of people go straight to the line of percent body fat. And of course, percent body fat is the percentage of the fat divided by the percentage of everything. And so if the fat-free mass is changing up and down, then the everything part of that equation changes as well. So while it doesn't change the grams of fat assessed on a DEXA scan, it will change the percentage body fat number that you get at the end of that.
Correct. And that, as you said, that's the number. I mean, I say it even in my email to athletes when reviewing a DEXA scan. The number, the percentage is not the most important number, but because I know you're going to look at it, here's your number. And I can recall one individual in particular. He'd been on lower carbohydrate intake. He'd done fairly high intensity exercise the day before, did a DEXA, percentage of body fat went way up. And now looking at this study, I'm like, well, that makes sense. It fits perfectly with this study and what they found with this and that manipulation of exercise and diet and how it can have an impact. And he was like, I just don't believe this anymore. And it was like, well, you can believe the results. What you have to believe is what you did actually had an impact on the results. And so the measurement was correct. It's just that you had this sort of, external impact on the results. And so he then repeated it and we did it where he didn't do any exercise the day before. He also was well fed, and lo and behold, everything came down back to where we expected. So it was a nice little proof of pudding sort of for him as well. So where he could see that acute sort of manipulation and how it did impact it. It was a good learning for the coach as well. Matty Dixon was like, oh, okay, that's actually pretty interesting. And I think mental note for him when, writing out the plans, how to actually think about, structuring that week in conjunction with an assessment. So what did this study answer in a nutshell?
Yeah, well, basically answered, do we need to be concerned about trying to control or standardize, if you like, both the diet side of things and the training side of things the day before a DEXA and an RMR test? And I guess the answer from that is for the RMR test, unless it's, if it's, zone 2-3 training, less than, 3-4 hours, the answer is probably you don't need to worry about it. Over that, we don't know, I think is the takeaway from this. And the authors were clear to state that. It's not just saying, you can do whatever you want exercise-wise. You can come off the Tour de France and measure RMR the next morning. It's clear that it's for that type of exercise specifically, and for more intense stuff, we're going to have to do more studies in the future. But for the DEXA side of things, obviously, it is much more important that you do try to standardize your hydration, how much glycogen you've got in your muscles, which is obviously affected both by diet and by training. So trying to standardize those things as best as possible is important. And obviously, as you said, often people, if they're going to do one of these tests, they're doing both of them together. So essentially, you are going to still have to standardize for the DEXA, which will then standardize the RMR anyway.
Yep. And it got me thinking about these assessments because typically you will do them together. But what I also know, the psychology of the athlete, well, maybe if I don't eat any food the day before, I'm going to be a little bit lighter, and that's probably going to be better for my DEXA. Actually, it's probably going to have a negative effect on it. So what you don't want to do is starve yourself the day before just so the weight number potentially comes down, because in the end, as you said, the estimate of fat-free mass is probably going to be reduced. The amount of fat stays the same, but that percentage of body fat is going to be influenced. And so I think it's a really good take-home message for athletes, like, don't suddenly change your nutrition and try and reduce it, especially if you are being told, hey, eat plenty of carbs the day before because maybe you've done some training and it's in line with whatever your purpose is. Don't go suddenly changing that from the recommendations of like the practitioners, because it will probably result in, in some results in the DEXA that, you're probably going to be pretty unhappy with.
Yeah, well, not only that, at the end of the day, you're collecting this data for a reason to inform what you're doing. So why would you try to cheat to manipulate the data? It's just going to misinform you.
Yeah. But unfortunately, in the real world, we see it all the time. People trying to cheat the system. So don't cheat it. It will always find you out. What did it open up? You've touched on some of it. Exercise duration, exercise intensity, longer and more intense. We don't know what the impact is on RMR.
Yeah, absolutely. And I think there's probably some sort of roundabout evidence that there might be an effect. There's been some studies looking, for example, at professional cyclists with doubly labeled water, sort of looking at total energy expenditure and then measuring RMRs and then having a look at the total calories expended off the bike. And it's certainly a lot greater than you would stereotypically expect of a cyclist when they're between stages and trying to recover, which suggests that there is an increase in sort of resting metabolism through that recovery process if you've done a lot of hard work. I mean, this was during a stage race. So, yeah, there probably is some suggestion that we do need to go back and look at that in more detail. So, yeah, I think it's still important to have that in the back of our mind.
Yeah, and I think, as we said, it just means do it early in the week before the coach gives you the harder stuff, and you'll be fine. What about calorie deficits and its impact? Like, what has it sort of opened up further research sort of questions?
Like in terms of RMRs?
Yeah, in terms of RMR, what are we thinking?
Yeah, well, I don't think it's necessarily answered any new questions or opened up new questions that we didn't already have. I think we already had those questions just in terms of, RMR suppression has been assumed to be part of low energy availability, but how suppressed does it need to be before we say it's a problem? How significant does the low energy availability have to be to get there, or how long do you have to be in low energy availability to get there? They're all still questions that we don't have answers to. And there's a lot in low energy availability research that we don't have answers to because it's really difficult to study accurately. To actually manipulate energy availability with any degree of accuracy, you've basically got to completely control someone's life for a prolonged period of time. And that's the hardest thing you can ever do as a researcher. And even the things like, we talk about low energy availability being below, that sort of 30 calories per kilo of fat-free mass per day. But even that is based on a single study over 4 days in only female athletes. And we're making all of these assumptions and put this line in the sand and saying below this is low energy availability and above it's not. Well, it's like, really? No. And the people who work in this field are the first to admit that shouldn't be done. But I think it's very tempting to do it. And as soon as one person says it in a public forum, it becomes gospel very quickly.
Yeah, unfortunately it does. And that was something they flagged, wasn't it? The whole suppression of the RMR and sort of, where that's come from, and maybe looking at, okay, we need to now stratify individuals maybe and look at it in a different way, male, female, firstly, looking at I think what else do they flag? The age of the athlete potentially could have an impact, the exercise, the ability of the athlete, like their training sort of experience. And so now you're starting to say, okay, can we make it more specific to the individual athlete, not just, as you say, throw this blanket of, 30 calories and this suppressed sort of RMR based on what we would expect. It's probably going to be very different based on the individual.
Yeah, absolutely.
What else? What else was there in there? Food consumed. I guess that opens up the question, doesn't it? Does that impact? And as you said, the trunk was the area where it seemed to have the most influence. So would they then, if they were going to do something, would they put some sort of tracer in there and see, would that have an impact? Or
yeah, not too sure, to be honest. I think the takeaway, though, is that if you are doing a DEXA scan, we talked about the glycogen, we talked about hydration status, but it's even simple things like making sure you go to the toilet before you do your scan, emptying your bladder, emptying your bowels as much as you're able to. Because even, a full bladder, there's an extra 0.6 kilos of fat-free mass on your DEXA scan. Empty the bladder, all of a sudden your fat-free mass has gone down 0.6 kilos. So yeah, just little things like that, I think are super important.
Yeah, and that actually brings me, as you're saying, isn't it? The amount of water intake was not assessed in this particular study, and so hydration status could have been impacted and whatnot. So it's probably something that they probably looked at afterwards and went, oh, maybe we should have done that. But I guess, that I think the authors did an incredible job at controlling a lot, and actually the design of the study was fantastic. And as you say, doing 5 different measurements with that number of athletes, I think was a job well done. Any steps other than the hydration that you would sort of, you'd like to see for future studies?
I think just the impact of more strenuous exercise, as we said, is probably the biggest one, to see how that would impact things. That's probably really the main one, I think.
Yeah, so look, I think, for everyone who's listened to this episode, I think RMR, DEXA, useful, very useful. They can give you some great information. I think what you've just got to be aware of based on this study and, as you mentioned, some previous studies, especially around body composition, that what you do the day before in terms of exercise and nutrition will have an impact on the results that you get given from a DEXA scan. RMR probably won't, based on low intensity exercise, maybe up to 3 hours. But given that you will likely do both on the same day with assessment, you need to take into account diet and exercise the day before in order to ensure that the results you're getting are repeatable and as accurate as possible.
Absolutely.
Pretty good. Righto, mate. As always, I love diving into this research with you. Your attention to detail is second to none, so thank you. And if anyone's got any questions, if they've got comments about this episode, if you've got particular studies or areas of interest that you want Alan and myself to discuss in our 2 Scoops of Science, then please make a comment in the comment section. And Al, I'll probably see you later. I'm sure we've got athletes and nutrition to discuss. But until then, mate, thanks as always, and I'll catch you soon.
No problem. Pleasure.